Welcome everyone to today's Gentle Movement at Home session. We are in the last week of Gentle Movement at Home. So I'm Jen Hansen and joined today by Colleen Jorgensen. Just a couple announcements before we start. So Colleen cannot provide specific medical advice for your condition. As you know, if you do have anything that is about your specific health situation, we do encourage you to speak with your healthcare provider. Colleen, however, is available to answer any questions about the stuff that she is presenting in this section. So if you do have questions, we'll take a few minutes at the end of this, and we'll just spend a few minutes with Colleen. You can put your questions in the Q&A, and I will ask them to Colleen, and she will respond. So we're recording this session, as we do with all the sessions, and they are available on our Facebook page or also on PNBC's YouTube channel, and we try to get them up pretty quick afterwards. So even after all of these, even after we take our summer break, you're very welcome to go into the archive and have a look at our over 30 sessions that we have. I'm gonna just launch a little poll at the end, and we just ask that you fill that out. It doesn't take very long, and your feedback really helps us. And then finally, if you have any technical concerns or questions for me, you can email me at education@pnbc.ca or just put your question in the chat. So we have one more session. I'm a little bit sad about this. This has become like quite an important part of my week, is hosting these sessions. So tomorrow we're with Neil, and that's going to be our last session at 1 o'clock. I hope that you can all come, and we'll just sort of have a celebratory moment tomorrow for people that have been with us for the last couple of months. So that's all I've got for today. I'll turn it over to Colleen, and wishing you all a really great time in your movement practice today.
Thanks, Jen. Thank you, PNBC, and welcome everyone. So for today's class, we're going to be lying down the whole time, so you can set yourself up with a mat. If you're someone who likes extra padding, then go ahead and put folded towel or blanket over your mat for the extra cushioning. I'm going to start in sitting to guide you through a breath practice. If you want to go ahead and lie down right away, you're welcome to do that, but if lying in one position for too long is a challenge, then you can start in whatever position is good. I just wanted to demonstrate an option. If you're someone who likes to be lying down, but lying down flat is a challenge, there is a nice way that you can do it. So I'm using yoga blankets, but you don't need anything fancy. You can just use regular bath towels. You would use two. So you would put one down folded, so it's got a little bit of a height to it, maybe ½ an inch to an inch. You would fold a second one, either the same height or double it, and you're going to lay it on top of the other so that you've got about a foot of space between the two. So when you lie down, your pelvis will go on this part here, your rib cage will be supported by this part here, and then you would need to pile up with pillows so that your head is in line with the rest of you. So basically it brings you on a little bit of an incline, which can make a big difference if you're someone who struggles with the lower back, feeling unhappy when you're lying completely flat. So as I said, we're going to start with the breath practice. I'll be seated, but you go ahead and set yourselves up lying down flat or with this incline, whatever works for you, or you can stay seated with me. So I'll just give you a moment to set up. And I will just point out that the only things you need for today's class are a few blankets and pillows to prop as you would like. If you happen to have these little balls that are just from the dollar store, you can go ahead and use them today, but I'm going to give you an option without them and an option using a towel instead, so don't panic if you don't have it. So I'm going to assume that you're in position now. Just go ahead and close your eyes in whatever position you've chosen. Just take a minute to settle into your body, settle into the rhythm of your breath without trying to influence it yet. Just notice when you're not trying to influence it, what is it doing? And as you do this over time, you'll start to notice that it can be different from one day to the next. It can be different from 1 hour to the next, depending on how your day's gone, how your pain is, how busy or stressful you are in that day. So just notice those changes, how much the breath is a part of our day, our state of mind and our state of being. Let's go for 2 more breaths, just observing. And then you can gently open the eyes if you want to see my hand placement, but I will describe it, so you're welcome to keep the eyes closed. So whatever position you're in, you're going to find the bones at the front of the hips that sort of stick out. If you lie down on your stomach, they're the ones that point into the floor. They're called the ASIS. And you're going to let your fingers come about 1 inch or half an inch to the inside of those bones. So you're palpating the lower abdomen. You're going to take regular breaths in and out through the nose. And on every exhale, I want you to very gently, just ever so slightly, tighten up the muscles and the skin underneath your fingers. So you go ahead and do that at your own breathing rhythm. Essentially, we're working what's called the TVA, the transverse abdominis. It's a muscle that wraps around the lower abdomen and all the way to the back of the body. And when you're trying to connect with it, rather than thinking of contracting it like you would a bicep when you're lifting a weight, for example, instead I just want you to think that you're tightening up the skin of a drum. So it's very subtle, but you will feel a little something change under your fingers. So for a couple of more, on your inhales, you let it go. On your exhales, you go and tighten that up a tiny little bit. And if it's helpful for you, you can think of bringing your belly button down to give a little kiss to your spine, and that might help to wake that connection up a little bit. Last time. Okay, pause. We're going to leave that for a moment. Now you're going to bring your hand to your lower rib cage. I'll exaggerate the hand so that you see what I mean. On the inhales, we just let what happens naturally happen. On the exhales, you're going to actively use your muscles a little bit to slide the ribs towards each other and a little bit down towards your pelvis. So as we breathe in, they tend to open up away from each other. As we breathe out, they'll naturally come towards each other, but I want you to exaggerate it just a little bit. So go ahead at your own rhythm. It can be helpful to have your hands there. Regular inhales through the nose, regular exhales through the nose, and on your exhale, see if you can ever so slightly exaggerate that sliding of the ribs towards each other and a little bit towards your pelvis. And as you do that action, notice how that feels in the back of the body. You might notice that the lower ribs come in more contact with the floor if you're lying down, or more in contact with the chair if you're seated, or just more supported if you're sitting like me and you're not against anything. So let's leave that for a moment. Next, you're going to bring your attention to your shoulders and shoulder blades. So on the inhales, we do nothing active. On the exhales, I'm going to exaggerate it. You're going to ever so slightly roll the shoulder joint open as you ever so slightly kiss the shoulder blades towards the spine. So it's a combined movement, 2 actions together. So inhale, nothing special. On the exhale, I'm going to make it big, but you're going to do it small. Roll the shoulders open at the same time as you kiss the shoulder blades towards the spine. Inhale, you let it go. Do that a couple of times, following your own breathing rhythm. And again, just notice what that changes. Do you feel an increased sense of support that feels good? Or do you feel that things get too stiff and it doesn't feel good? Try to find the happy medium. One last breath, focusing on that aspect. And then pause. And then the last one is the position of the head on the neck. We call it an OA nod or a chin tuck. So regular inhale, I'm going to exaggerate it, but it'll be very small on you. On your exhales, I'm going to use my finger just to show you the action. On the exhales, you're going to slightly draw the chin back like you're closing a drawer at the same time as you get more length at the base of the skull, but it's very, very small. So inhales, nothing special. Exhales, go and get that little bit of extra length to the base of the skull, making sure that you don't create rigidity there. You're looking for length, but no rigidity. If you were seated like me, it's like you have a helium balloon, making your head a little bit lighter. Last time. Okay, so now we're going to put all of those together. We're going to stack them. So regular breath in. On your exhale, you're going to tighten up the lower abdomen, funnel the ribs, set the shoulders and shoulder blades, and get that length through the base of the skull. Hold it for one full breath in. Hold it for one full breath out, and then let it all go. We're going to do that a few times in a row, and we're going to hold it for an extra couple of breaths each time. So regular breath in, a nice slow breath out to get the lower abdomen, funnel the ribs, roll the shoulders open as you kiss the blades together and lengthen through the base of the skull. Hold all 4 of those things for 3 full breath cycles. If you'd like, you can even exaggerate them a tiny little bit on each exhale, but only if you can do so without creating rigidity. You still want to always feel like you're a bit of a bobblehead in your spine, that you've always got that ability to dance in your spine. Let's go for one more full breath cycle, in and out, and then let it all go. And we'll do that one more time, holding it for a little bit longer. So regular breath in, make it nice and long, slow, smooth and soft. Slow breath out to get the lower abdomen, funnel the ribs, roll the shoulders open as you kiss the blades towards the spine and get a little bit of length through the base of the skull. Keep all of those for 5 breath cycles. See if on the inhales you can hang on to those connections a little bit. And then on each exhale, you just deepen the connection. It's not that you're contracting harder, it's that you're trying to get more aware of that connection. And every exhale is another opportunity to connect a little bit deeper with those actions that you've created. And as you're holding through these breath cycles, just notice how your whole body feels when you give it that extra little bit of support. And when we go into our movements in a moment, every now and then on your exhales, see if you can go ahead and tap into one of these 4 actions or all 4, or any combination that feels good. And just relax and let it all go. Okay, so we're going to get started now with our movements. So if you're already lying down, you're going to stay there. If you're not lying down already, we're going to lie down. I'm going to give you the option of adding a towel. You don't have to. You can do this exercise without it, but I'll just show you the option. So if you're using a towel, you fold it in half, fold it in half again, and then we're going to create a roll out of it. We're going to be lying on our backs, and we're going to place this in between the shoulder blades. So it's going to go along the spine, in between the shoulder blades. Again, if you're already set up and moving is hard for you, you can do this exact same exercise without any roll there whatsoever. It just gives a little bit more freedom of play in the shoulder blades, but you get the same benefit without it. So if you're choosing to use it, it goes between your shoulder blades, and then just make sure that your head and neck are in good alignment. So if you're using a roll, it's going to bring your torso higher, so you might need more pillows than you had a moment before. Okay, we're going to float the arms to the ceiling. You're going to slide your shoulder blades away from the spine, and it's like you're trying to reach towards the sky. And then slide your shoulder blades towards the floor. And if you're using the roller, you might feel your shoulder blades kind of hug around the roller. If you're not using a roller, you'll just feel your shoulder blades come flat in contact with the floor, and both are good. So slide the shoulder blades towards the ceiling, they come away from the spine. Slide them down to the floor, they come closer to the spine. Let's do that 2 or 3 more times. Follow your breathing rhythm. So if I'm going faster or slower than what feels good in your body, you just adapt and do what feels good for you. Notice that my elbows are staying lengthened. Sometimes if we're tight around the shoulder blades, our body's very smart, so it'll try to cheat for us by bending the elbows so it feels like we're doing the action. But if your elbows are bending, you're missing all the good stuff. So keep the elbows lengthened as you slide the shoulder blades down towards the floor. Let's do it one more time. Sliding up towards the ceiling, down towards the floor, and then let the arms just come to rest. I'm going to give myself just a little more height under the head so that I'm in a better alignment. So now we're going to use the right arm only. So the arm is towards the ceiling. Take a moment to drop the shoulder blade either down into the floor or around your roller, depending on what you're using. With your other hand, you're going to just place your hands on your lower rib cage so that you can feel what happens in the ribs as we move the arm. So we're going to do little circles. Imagine that someone's up at the top of up at the ceiling like a puppeteer, and they've got string attached to your fingers, go the other way, and you're just very gently being circled. And then start to go overhead as you're circling, and under this hand, notice that the rib cage gets pulled with the arm, and that's normal. Keep circling as you come back towards the center, and notice how the ribs come back to a more neutral position. Circle in the other direction and do the same action. You can also notice as you're circling the arm, does your weight shift side to side in your pelvis or at your feet? And if so, it's a nice reminder that regardless of what body part we're moving, we are affecting the whole body. Let that arm rest by your side for a moment. Bring the other arm up towards the ceiling, drop that shoulder blade down, and then place your right hand on your lower rib cage. So we're going to start with circles just here, really soft. The elbow is lengthened, but it's loose. The fingers are lengthened, but they're loose so that we don't have any more tension than is necessary. And now keep circling and allow the arm to start to go overhead. And how far you go depends on how it feels in your body. You go to where it feels good. It's okay to feel a mild pull. And slowly work your way up, circling still in the same direction. Every now and then bring your awareness to what's happening at the feet, knees, and pelvis. Circle in the opposite direction. Keep circling. And pause. So I'm going to ask you during all of that, did you take the opportunity to check in with any of those 4 actions we had done at the beginning? And if not, see if you can add that in on the next round. So we're going to have both arms to the ceiling on this one. We're going to do this in 2 different ways. So the first version, as you inhale, you're going to let your rib cage float up and follow the arms and shoulder blades and allow your shoulder blades to come right up into the ears. So feel how the arms and shoulder blades are connected to the ribs, and all of that moves up towards the face as we bring the arms overhead. On your exhales, use those little tricks we did before to funnel the rib cage, connect the lower abdomen, keep the shoulders open as the arms come back to here. So inhale, arms go overhead, let the rib cage open and follow, let your shoulder blades come right up into the ears. On the exhale, use your breath to funnel the ribs towards your pelvis to help you to bring the arms back over the chest. We'll do one more like that. Inhale, arms overhead, let the rib cage follow, let the shoulder blades come right up into the ears. Exhale, funnel the ribs, connect those abdominals, lengthen through the base of the skull, and bring the arms back over the chest. So now we're going to do the exact same movement, but we're going to switch our breath cycle, and we're going to change what we're allowing the ribs to do, okay? So arms over the chest. Let's take an inhale here without moving. This time we're going to exhale, funnel the ribs towards your pelvis and allow the arms to go overhead only as far as you can go without the ribs following and without the shoulder blades following. So for most of us, we will not be able to go as far, and that's normal. And then we're going to inhale to bring the arms back to center. Exhale, connect the lower abdomen, funnel the ribs towards the pelvis, keep the shoulder blades in place, and slowly let the arms go overhead. Only if I go any further, my ribs are gonna pop up. So this is the end for me. Inhale, we come back over the chest. Let's do that one more time. So exhale, connect with the lower abdominals, bring the arms overhead, but only as far as you can go without those ribs following. And slowly come on back. Relax the arms. Let the arms rest in whatever position is comfortable. If you're on the incline and it's too far to let them rest on the floor, you can go ahead and let them just rest on your body, okay? With the head down. So remember that length we got at the base of the skull. You're going to keep that length. Allow the head to turn a little bit towards one side. Eyes closed. You're going to gently nod the head forward and back like you're saying yes. Pause there. And then shake the head side to side like you're saying no. I'm just going to remove my roller. Pause there. Keep the length at the base of the skull by drawing the chin slightly in and lengthening to the base of the skull to bring the head back to center. And then we'll do the same thing towards the other side. So turn your head in the opposite direction, eyes closed, gently nod your head like you're saying yes. Gently shake the head side to side like you're saying no. Pause, bring your head back to center. Using whatever hand is convenient, you're going to place the heel of your hand on your forehead. You keep your head completely supported on the floor, on your pillows, whatever you're on, but you're going to lightly press into your head with your hand as you press your forehead into your hand. So you're firing up the muscles at the front of the neck, but you're not leaving the support of your pillow. Let that go completely. We call that an isometric contraction, where we're contracting the muscle without any movement. So hand to head to hand, feel how that fires up the muscles at the front of the neck. Pause and hold that, and then let it go. We'll do that one more time. Press hand to forehead, forehead to hand, hold. Feel that connection in the front of the neck, and gently let it go. Now try to keep your head heavy on the mat as you turn onto one side. If you were using the incline and or the roller, we're going to take all of that away now. You can keep the props nearby in case we need them again later, but for now we won't be using them. And then you're going to come back onto your back. So best thing is to lie back onto your side and gently turn onto your back. So we're going to have the feet hip distance apart, knees as well, feet distance apart. For now, we're going to have the arms alongside the body with the palms facing up. Not too close to the body. Let's go in a little bit of an open V. We're going to do a movement of pistons, we're going to call them. So the action is we're going to float one knee up like so, letting it come back down, and we're going to alternate sides. Now you have the option here. If you've got two soft balls, tennis balls would be too hard, you have the option of placing these just on either side of the sacrum, quite low down in the cheeks, and just notice whether you prefer the feeling in your body of having that support under the pelvis or not. If you don't have balls, you can do the exact same thing with that roll that you had just been using between your shoulder blades. You slide it underneath your pelvis, towards the lower part of your pelvis, definitely not at your waist, okay? So I prefer having that support, so I'm gonna go ahead and use it. So we're gonna float one knee at a time. Notice how I'm allowing my foot to be floppy and close to my pelvis rather than keeping it at a 90-degree angle. I'm doing that on purpose so that we don't use more muscles in this action than is necessary. Same thing other side. And see if you can get the sensation that someone is lifting you rather than you're contracting to lift. Now just watch this slight change for a moment. Take a look at my feet. If I really press into the floor with my toes, it makes my leg a lot lighter. So see if you can play around with that. Instead of only thinking of the leg when you lift, if you think of pushing down into the floor to push off with your toes, it makes the legs a lot lighter. And the same is true when we're walking. So if we skip that action of pushing through the toes, we have to use our hip flexors, our quads, our glutes, our hamstrings, more than is necessary. Whereas if we learn how to work through the feet, we can take a lot of the energy that we maybe waste sometimes using more muscles than necessary in walking. So we're going to keep this leg up this time. You're going to keep that leg floppy and you're going to bring the other leg up to join it. So this is now our starting position. And from here, we're going to gently let one leg come down at a time. Once the tips of the toes touch, we bring it right back up. So for these ones, you can place your hands on that same part of just to the inside of those hip bones on the TVA. And what I would suggest, let's take a breath in here together. Exhale, connect that tightening of the drum underneath your fingers and use that to support the lowering of the leg. Pause here for a breath in. Exhale, use that support to come on back up. If you find it's a little bit too much of a challenge, you can use a towel, a belt, you can hold on to your pants, and you can do the exact same thing, but giving yourself a little bit of support. Let's go one more time on each side. So if you don't have a belt handy, you can hold on to your pants. And just that gives you a little bit of support, makes the leg a little less heavy as we lower it. So it makes it a little less work for the abdominals and for the lower back. Let the legs come down one at a time. If you've got something under there, take it off for a second. Step your feet a little bit wider than your mat. Arms to the outside in a T position, and you're just going to let the legs fall to one side and then the other. We call this the windshield wiper, to just let things free up a little bit. And then you're going to come back to that same position. Feet are hip distance apart. There's nothing under the pelvis. We're going to go into a bridge position. For your first one, go ahead and lift the pelvis up as high as feels possible for you. And notice how when you get to the top, it feels like the whole buttock contracts, and it might feel like there's some compression. Compression may not be the right word, but we feel the action right into where the lower back is. So slowly come on back down. That's not a bad thing, by the way. Now we're going to do it again, and we're going to try to focus on the lower part of the glute muscles, right where the hamstring attaches to those sit bones. So you're going to come up only high enough. So for me, it's right here, which on camera may not look like very much. I'm only a couple of inches off the floor. For me, if I go higher, I feel those upper fibers start to kick in, which is fine, but not what I'm looking for today. So I'm going to stay a little bit lower. So find your level. If my hands are my pelvis, I'm then going to drop one cheek until it touches the floor and bring it back up to where I started. Drop the other cheek, come back to where I started. I'm going to keep alternating sides. Maybe change your arm position now, open into a T. And keep finding the height that keeps you engaging the lower fibers of those glutes, not all the way up into where the lower back is. Slowly let the whole thing come down. You're going to lift your left heel off the ground. So really push it as high as you can, like you're standing on high heels. Do the exact same thing. You come to whatever level fires only those lower glutes and slowly lower yourself back down. As you do this, this is a great opportunity to check in with those 4 actions that we had done at the beginning of class. So every exhale, you can tighten up the skin at the lower abdomen, you can funnel the ribs, you can open through the shoulders, and you can lengthen through the base of the skull. One more time. So know that with every single movement you do in life, same thing on your side, whether it's an exercise class or not, you have that option of on your exhale, just getting those connections to create a tiny bit more support in your movement. Same thing other side. So we've lifted the opposite heel and we're coming up only high enough that we feel the lower part of the glute muscles, those muscles in the buttock, close to where the hamstring comes and attaches. So where the hamstring and the glute meets, that's where we're trying to put our focus here. Last one. Come on back down. So now I'm going to ask you again, if you've got the balls, you place them, or you place your roll, or if you prefer, you place absolutely nothing. It's really whatever feels better for you. We're going to bring the right knee in towards the chest, lengthen it to the ceiling to get some length through those hamstrings that we just worked, and then slowly lower the leg down with control until it touches the floor. Drag the foot and toes along the floor to bring it back in to start again. I would suggest exhale on the way down and get your connection, lower abdomen, ribs, shoulders, base of the skull. Inhale as we bring the leg in. Exhale as we slowly lower it down. Use the pressure on the floor to wake up those feet on the way back in. Same thing other side. So knee comes in. So I have a bit of trouble on this side, so I need some support. So I'm going to hold on to my pants as I do it so that it takes some of the weight out of that leg. If you have a belt, a strap, a scarf, you can use those as well. That'll give you the same bit of support. So Exhale, lower abdomen, funnel the ribs, open the shoulders, lengthen the base of the skull. Subtle. We're talking very, very small motions, but they add that little bit of extra support, almost like you're putting a corset on around your spine. And neutral. We're going to reverse that pattern. So go back to your right leg, lengthen it along the floor, lift it up, fold it in. Here we're going to use our exhale to lengthen it along the floor. Slide your foot along the ground. Feel that contact with the earth. Inhale to bring it up and fold. Exhale to slide it down. Keep that connection through all four parts. Inhale to bring it up and down. Last time. Slide along the floor. Inhale to bring it up and in. Same thing other side. Lengthen. Inhale the leg up. Exhale to fold and then really connect with the floor. My mat is sticky, so it goes chick, 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 but that's fine. I want that contact on the floor to inform my foot. We're so often in shoes, it's a really lovely gift to give your body to have bare foot on the floor and feel that contact. Last time. And back in. If you've chosen to have something underneath your pelvis, you go ahead and take them out at this point. Either hand on your forehead. The head stays in contact with the floor. You press hand to forehead, forehead to hand, forehead to hand to fire up those neck muscles a little bit. Hold. Gently release. One more time. Isometric contraction there. Just hold. Gently release. And we're going to turn onto our sides. You guys go ahead and lie on your side. I'm just going to grab my props. If you'd like a pillow for your head, you can grab one now. We're going to use that same roller that we had done before, but we're going to make it a little bit shorter. So after having your towel folded in half, start with it folded in half, and this time we're going to fold it in thirds from there. Whereas previously we had done half and then half again. And then I'm going to recreate my roll. It's just going to be shorter in length. It's not the end of the world. If you don't feel like redoing your roll, it will work just fine to keep it as it was for the previous exercise. So we're going to start lying on our side. Doesn't matter which side you start with. Let's go ahead and place that roller in between your knees so that your knees are further apart than your feet and ankles are. We're going to go ahead and flex both feet and imagine if the bottom of my feet were the pages of a book, you want to open up the book. You know when you open a book and you want to read it, but sometimes you can't see those words that are close to the seam? So that seam is where my inner parts of my feet join. You want to open that up so that it would be like I'm standing on a flat surface with those feet. From here, if you want to palpate where we're working, you can place one hand on that hip bone we were on before, fingers on the sacrum, depending on how long your hand and mine doesn't reach. The halfway point between the two are the muscles that we're going to be targeting right now. So I like to have that connection and feel it. So you're going to keep the knees together and you're going to pivot around that roller to bring the lower leg to the ceiling. Basically what we're doing is internal rotation of the hip. So go ahead at your own rhythm. Here again is a really nice opportunity that with every exhale, you go and get that connection with all four areas that we talked about at the beginning. Pause here, point both feet, and do this exact same action of internal rotation of the hip, but with the feet pointed. Now for some of you, that might make you cramp in the feet and or calves. If it does, just relax the feet, let them be floppy, but every now and then see if you can gently start to initiate that point until eventually one day you can do that full point without cramping. Let's do one last time. Now you're going to move the roller to in between the ankles. So now the knees are going to be closer together than the ankles are. We can place our fingers in the exact same place. This time, flex the feet again, like we're trying to open that pages of a book, and you're going to spiral to lift the knee to the ceiling. This time we're doing external rotation of the hip. And as you come down, make it really slow, like you're moving through thick, thick, thick molasses, as opposed to using all your effort to get the leg up and then just letting it fall. The best part of the work is the resistance on the way down. So with your fingers on those muscles, feel that you're maintaining that connection under your fingers all the way till the knees touch. Then it can soften under your fingers, and then tighten it up again to lift that leg and keep that connection under your fingers, really slowly letting the leg come back down. You're controlling it with those muscles under your fingers until the very last moment, and then it all lets go. You're gonna grab your roller, keep it close by, but we're not gonna use it for a moment. So you're gonna place your top foot behind your bottom leg, and the bottom leg is completely in line with your body. So if your legs were forward of you, now put them all in one straight line. The outside edge of your bottom foot, from especially the pinky toe and the knuckle of the pinky toe, are going to stay in contact with the ground the whole time. And you're slowly going to flex the foot as much as is available to you and point the foot as much as is available to you. But as you go back and forth between that point and flex action at the ankle, you're actively pushing the outside edge of your foot down into the floor, especially at the knuckle of the baby toe and at the baby toe itself. So what this is doing is it's waking up those muscles along the outside of the lower leg in particular, which are muscles that we tend to forget about sometimes, and they can get a little bit lazy. So we're trying to wake these up. And then remember this feeling, because we're going to call upon it for the next part of the exercise. Last time, so you might be waking up an area that you've never felt before. So tomorrow, it might say hello to you, and that's not a bad thing. It's just going to be telling you, oh, okay, we worked yesterday. So now you're going to place your roller in between the ankles. Make sure it's at the ankles, not the feet. And go ahead and get yourself in one straight line. Now, if in a straight line, you feel like you're really off balance, you have two options. Either you can place your top hand on the floor for a little bit of support, and or you can go ahead and bring the legs slightly in front of you. If you are going to do that, over time, see if you can work your way to eventually getting the legs in line with the body. It's a nice challenge for our balance to do that. So hand on the floor if you need it, arm on the side of the body if you don't need it, or you can play with putting your arm anywhere, just to make it fun. Do what you would like. So we're going to start with floppy, floppy feet. I'm going to use my hand actually just to show you what we're doing. So the whole side of the hip, the whole half of the pelvis is going to slide towards my foot. So my waist is going to get longer on this top side. And then I just resist to allow it to come back to neutral. So I'm not shortening the top side. I'm going to lengthen it, hold there for a moment, and then slowly resist, allowing it to come back to its starting position. So we get longer at the top waist, we hold, and then we just let it come back. Now, keeping the bottom edge of your foot in contact with the floor very actively, we're going to flex both feet and then do the same thing. So lengthen that top leg, get that top waist really long, pause, slowly let it come back. Two more. And just notice, now that we've added the action of the foot, does it feel different in your waist, in your lower back, in the abdominals? Maybe it does, maybe it doesn't, but it's always interesting to see that when we change something very far away from the work that we're doing, always interesting to note how it affects it. Now go ahead, keep the outside edge of the foot pushing into the ground and point the toes. And then last set, lengthen that top hip. Come on back. Again, lengthen. Come on back. Lengthen. Come on back. Let both knees bend, grab your roller. You guys can go ahead and turn onto the other side so that you're facing away from the camera. I'll lie on my other side just so that you can see me. If you prefer to still see the camera, you can do the same. So lying on one side, you can support your head with your arm or place a pillow there. And your ruler goes between the knees. Flex both feet. You can go ahead and palpate the muscles if you like. We're going to go into internal rotation of the hip and slowly we'll let it come down. So as you're doing that action with the hip, every exhale, you can use the opportunity to tighten up the skin and the muscles
In the lower abdomen, funnel the ribs, slightly open the shoulders and kiss the blades, and slightly lengthen through the base of the skull. Go ahead and point the toes and do the same action. Now, if you find it's too much to do all 4 of those things on an exhale, choose 1 or choose 2, and you can eventually add on to them as you get more used to doing that. You can choose the same one every time, or you can keep changing it up. So let's change to the ankle. So I'll give you an example here. So let's flex the feet to start. We're going to pivot around to lift that top knee, hold, and on your exhale, go and get just the lower abdomen connection and keep it as you slowly, slowly, slowly lower. On the next breath, we're going to funnel the ribs only and hold that as we keep the leg at the top, and keep holding the rib funnel as we slowly, slowly come on back down. On the next breath, we're going to just address the rolling open of the shoulders and the slight drawing together of the shoulder blades and hold that. Keep holding it as you slowly lower down. Point the toes, same action of external rotation, this time lengthen through the base of the skull and hold that. Slowly come back down. So for the last 2, you choose whichever one of those you want to go back to. You can choose your favorite, or you can choose the one that you found most challenging. Both are good. And as I say, if it's available to you, you can stack them. So if doing 1 is easy, try doing 2 of them, any 2. If 2 is easy, try doing 3. And if 3 is easy, try doing all 4. Remove the roller. You're going to lengthen both legs. Just make sure you can see the feet here. Not sure that you can, but we did it on the other side, so I think you know what we're doing. So make sure that the outside edge of the bottom foot is fully in contact with the floor, especially the knuckle of the baby toe and the baby toe itself. So, oh, sorry, we're going to step that top leg behind us. We're going to flex the bottom foot and point it. Flex and point. So you're going to slowly go back and forth. I'm not sure how well you can see my foot here, but if my hand is my foot, it's doing this, pointing and flexing. But the key is that you're maintaining contact and actively pressing into the ground as the foot goes back and forth to wake up those muscles on the outside of the lower leg. The peroneals are what they're called. And that can give us some nice support at the knees and really all the way out to the hips and lower back because of the chains of the muscles. One last time. And then grab your roller, place your roller between the ankles. Make sure it's the ankles, not the feet. Get the body in one straight line. Hands for support if you need. Anywhere you want if you don't need. Relax the feet for the first set. So you're going to lengthen that top leg, lengthen the top waist, and hold that. Just notice how that feels in the whole area of the lower back, the hips, the abdomen, and then let it go. Go for 2 more at your own rhythm. And I'm going to invite you again to see if you can add those 4 components in, either one of them at a time. Go ahead now and flex the feet. Bottom foot is really pressing into the floor, and do the same action. And notice, what does it change to add that foot action into this exercise? It's a very small exercise. If someone, well, you guys are watching me, it doesn't look like much, but it's very targeted. I feel a lot of support around my whole waist, lower abdomen, lower back. And then point the toes, keeping that outside foot pressing actively down into the ground. And then go ahead and lengthen that top leg and bend, not bend, sorry, just allow it to come back. And let it go. You're gonna just get rid of that roller. Go ahead and turn onto your backs. So you're going to place yourself in a starfish. So arms and legs are just open and a little bit of a V. If that's not okay for your arms, you can come down, that's fine. We're going to slide one leg along the floor to bend it, let it come to the center, let it fall open, and it slides back down. We're going to alternate sides. So we're really letting the knee point outwards in order to bend it. So use the floor to drag the leg along, knees pointing out. It comes in, back open, down, alternating sides. Let it be really loose, really free. On this one this time, when you come center, stay with the knee pointing a bit to the ceiling and just play a little bit in and out and find where is the spot where your hip feels most happy, where it feels the most amount of freedom. Just figure out where that angle is. The hip is a ball and socket joint. So right now we're rolling it a little bit in its socket. Where is the sweet spot for you? Let it fall all the way open and down. Same thing other side. So bring the knee towards the ceiling and then just play around a little bit at your own rhythm and find that sweet spot. Where does the ball feel most happy in its socket? And notice that feeling. And when we come to standing later, you want to see, can I find that sweet spot again? And let it come down. We're going to add the arms now. So as my left leg bends, so does my right arm. Knee comes in and they lengthen together. Opposite arm and leg bends. Now this time we're going to add on. So opposite arm and leg bends. This time I'm going to step through my legs, through my foot, until I come to land on my side. I'm going to reach with that top arm. My head is resting on my bottom arm. My foot is actively pressing into the floor. Now to come back onto my back, I'm going to lengthen that top arm overhead. Let the fingers graze the floor and try to get your shoulder blades back on the ground before your lower ribs. And release it off. Same thing to the other side. So opposite arm and leg bend. I'm going to push into my outside foot, reach overhead with my top arm. My head is resting on my bottom arm. Pause here. We're pushing down into the floor. Now reach even further with that top arm. Graze the floor with your fingers. Try to get your shoulder blades to come back onto the ground before your lower ribs do. And we release. One last time we add on a little bit more. So opposite arm and leg. This time come all the way over onto your side. And this time, if it feels available to you, you'll lengthen the top arm and leg, push into your bottom arm so that your head slightly comes off the ground. So it's a little bit more active all along the side of the body, both the top side and the bottom side. If that feels like too much, you go ahead and let your head rest on the floor. You go ahead and let your foot rest on the floor. Otherwise, stay here for one more breath. Now to come out of it, we're going to bend the top leg, foot comes to the floor. Reach the top arm, graze the floor with your fingertips. Let yourself roll. Try to get the shoulder blades on the ground before your lower rib cage. Let the knee fall open to lengthen. Last one, opposite arm and leg. Push into the foot to roll over to the side. This time, keep going. You're going to reach the arm and leg in opposite directions on a diagonal. Press into the bottom arm to give a little lift to your head and torso. And just pause here in this reach. If that's too much, foot comes down and or the head comes down. Otherwise, you pause here. And now bend that top leg, foot to the floor, reach the arm overhead, graze the floor with your fingertips, get the shoulder blade back down on the ground before your lower ribs. Let the knee drop open and bend both knees. Go ahead and turn onto your side to face the front. Come into a fetal position. If you're comfortable, you can support the head with your bottom arm. If you need more of a lift, use one of your towels or cushions. And if you like to have a cushion between the legs, go ahead and use that now. I'm going to come on up to sitting, but I'd like you guys to stay in the fetal position for a few breath cycles. So go ahead and close the eyes. This is a very comforting position for the body to be in. So let your body just kind of process all the nice work you did in today's class. You want to let it sort of marinate in there.
Try not to do anything specific with your breath here. Just notice the rhythm of your breath, be in contact with it. Notice if the rhythm or the feel or the depth of your breath, does it feel any different than it did when you checked in at the very beginning of class? There's no right or wrong answer to that, but if there is a change, it's interesting to notice it. Stay here for 2 more breaths. And with your inhales, try to fill every single cell in your body. Try not to keep it at just the lungs. Try to imagine that every cell has its own lungs and you're trying to breathe into each and every of our trillions of cells so that you're feeding your whole entire body with breath. And then keeping the eyes open or closed, whatever side you're lying on, you're going to press your hands into the floor, keep your head heavy until the very last moment, and push yourselves up to a sitting position. The head is the very last thing to come on back up. And we'll stop there. Thank you so much for joining me today. I hope you guys enjoy the rest of the summer off, but I hope you join Neil tomorrow and that you take advantage of the recorded videos for the rest of the summer. And I'm here to answer any questions if you have any.
Brilliant, Colleen. Thank you for that. I'm just going to do the poll. Great. Okay, I think everyone can see that. Just take a minute and fill in where you're from and then some info about today's session. Colleen, we do have a couple of questions.
Okay, perfect.
Regarding the rib funnel.
Yes.
Can you explain how it's done? And yeah.
I'm going to grab something. I'll be right back. It's right beside me here.
Sure.
It's not a perfect example, but it's a good example. So when I show you with my hands, I'm only showing you the front of my ribs because I only have 2 hands. But our ribs are like a barrel. They're like a whole basket that are 3-dimensionally around our whole body. When we breathe in, they naturally expand in all directions. For some people like myself, we have a posture where we keep those front ribs open all the time, and that shortens things in the back and can put some heaviness into the lower back. So if on our exhales, we can think of softening the front ribs down, because they're attached to the back ribs, it lifts the back ribs off. Does that make sense? So as it comes down in the front, they lift off the kidneys, off the pelvis in the lower back. So it does happen a little bit naturally if we're using our diaphragm properly, which I would demonstrate here. So imagine this is my diaphragm. At rest, the diaphragm is a little higher up. Can you see that, Jen? Not very.
Yeah.
Right?
Oh, yeah. Okay. Yeah.
So
Yeah.
as we breathe in, this drops down. As we breathe out, that comes back up. But when it comes back up, it softens a little bit. So we want to use that softening to soften the ribs in the front to come down so that 1, we're getting a bit of support through the abdomen, but 2, we're getting that lift off the kidneys and lower back in the back. Does that make sense, or do I need to go into that more?
It does. It's quite complex.
It's a little bit like a seesaw. Let me just do one more demo here. If this were my ribs, okay, and this is my front ribs, this is my back ribs, but remember they're attached together like a seesaw. So if on the inhale they're opening in the front, which they often do, on the exhale, if they soften down in the front, we get this lift in the back. I'm exaggerating it obviously, but we get this lift which gives us more space in our lower back and more support in the front.
I feel like when I try it, I can picture it and I can actually feel how it's working. Yeah.
Excellent. And then the trick is, if you're new to doing that, often what we do when we're learning is we funnel the ribs, but we take everything with us. So then we end up closing the chest and shoulders.
Like this.
So everything in the body is about opposition. So in a perfect world, you slide the ribs down, but you do that little heart lift at the same time so that this part stays open.
Right. Okay. I'm going to practice that. Okay, that's really helpful. Thank you. The next question is, can you just review how to relax your jaw?
Yeah, so the jaw is a very key area where we tend to hold a lot of tension. So there's a couple of different tricks. One, if we're not talking or chewing, our teeth should not be touching. That was revolutionary to me. When someone told me that, I checked in and I couldn't believe how many times throughout my day I wasn't clenching, I wasn't a grinder, but just the effort of the teeth touching uses those muscles a lot. So one thing you can do is just check in and every now and then make sure that the teeth are not touching. The second thing is the position of the tongue. So the tongue is a lot of muscle. So you can do one of two things. Everyone's a little different. You can allow the tongue to just sit in the floor of the mouth. Let it be heavy and wide in the floor of the mouth. That's a more relaxed way of relaxing the jaw. If you want a more active way, you can just gently place the very tip of your tongue on the roof of your palate. So both of those tricks can help.
I can actually feel it when I do that. I can actually feel my whole face.
Oh, good. Excellent.
Relaxing.
Wonderful.
I am a clencher, so that's.
Oh, you are. Okay. So if you're a clencher, especially if you're a clencher when you go to sleep, try to do those before going to bed to just sort of teach your nervous system that when it goes to sleep, hopefully it'll remember how good it felt to not be clenching.
It's a really good idea. Thank you. Well, okay, we don't have any more questions, so but those were really helpful reminders. I just want to say thanks, Colleen. Your classes have been super popular, and we're just so pleased to have had you. And everyone, thank you again for coming, and I hope to see you for the final class tomorrow. But if not, I hope to see you in September.
Perfect. Have a good summer, Jen.
Bye, Colleen.
Bye.
Take care. Bye.